Hi, my name is Victoria Mormon, and this is my presentation for the head to toe final. I'm just going to scan the room really quick. There's my patient for later, no papers or anything out, and I'm going to set this down. That should be good. Okay, so I'm going to go ahead and start. Hi, my name is Tori. I am your student nurse for today. Can I just get your name and date of birth?
Caleb Bowering, May 5th.
Okay, I'm going to scan your ID. I'm doing hand hygiene, and I would glove up and disinfect my stethoscope. Do you have any allergies I should be aware of?
Nope.
Okay, I'm going to close the curtain to maintain patient confidentiality and privacy, and then we can begin. So first, I'll go over here. First, I'm going to start with your neuro check. So I'm going to ask you 3 questions.
Okay.
Do you know where you are?
My apartment.
Do you know how old you are?
20.
And do you know what the year is?
2020.
Okay, patient is oriented times 3. They are dressed and their appearance is good for the situation and the weather. They are in their apartment, so shorts and a t-shirt is fine and acceptable. The patient is clean from appearance and there is no noticeable odor. And the patient has normal behavior and does not stutter when they talk and has no slurred speech. Next, I will be jumping to the heart. So I will do the heart assessment first. I'm going to take the patient's radial pulses bilaterally with my fingers and not my thumb. There's no pulse deficit noted. Next, I'm going to have the patient lie down so I can check for their apical pulse. Let's see the best way to, okay, yeah. I'm going to find the apical pulse. Apical pulse has been found, and what I would do is I would assess the apical pulse with the instructor and then do a full minute I would do the radial pulse as well as the apical pulse and check for pulse deficit and then get within 4 beats per minute of my instructor as well. So we would do that for a full minute, auscultating with the diaphragm. After we would do that, I would move on to assessing ape to man. So I would assess his aortic, his pulmonic, Erb's point, tricuspid, and mitral heart sounds. I would do this with my diaphragm and the bell, so I will do that really quick. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And then I would flip it, use the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. With that, I did not hear any murmurs, any extra heart sounds. Upon palpating too, there was no palpitations and there was no vibrations. So all heart sounds were normal. Just to verify that everything I heard was normal and in line, I am going to have the patient sit up and lean forward. They could have also done lying in a different angle, but just in our situation, sitting up and leaning forward is easier. So I would do the same thing again at a different angle. So now that they're leaning forward, aortic, pulmonic, Erb's point, tricuspid, and mitral. And then I would do this again with the bell just to verify normal findings, aortic, pulmonic, Erb's point, tricuspid, and mitral. Next, I am moving on to the lung sounds. So I'm going to inspect my patient first. I do notice no accessory muscle use or barrel chestedness, and his AP diameter is a 1:2 ratio, as you can see. For the rest of the lungs, now that I've inspected the torso and there is no abnormal findings, I will look at his posterior first, his posterior lung sounds, and I will do that in 5 different pairs. I'm going to have him sit facing that way. Yeah, there we go. And I'm going to assess while he breathes in through his nose and out through his mouth. So when I put my stethoscope on your back, breathe in through your nose and out through your mouth. If you're feeling lightheaded at all, go ahead and let me know and we can take a break. For COVID purposes, he's not going to breathe heavily. So 1, 2, 3, I'm going to have you lift your arms so I can listen to your breath sounds along your mid-axilla. 1, 2, and then I would do this on his other side. Perfect. 1, 2, and then lastly, I would assess anteriorly. So we would check twice above his clavicle. So 1, 2, and then I would assess 4 different points below. 1, 2, 3, 4, and I would do each of these within a full breath cycle. So no abnormalities, no wheezing, no crackling or anything like that heard within the lungs. And when they were assessed, they were bilaterally symmetrical, and both lungs sounded even and equal, which is a normal finding. Next, I'm going to circle back to the first page for your grading purposes, and I'm going to move on to the eyes. So I would disinfect the stethoscope. I'm going to use my pen light to first just inspect his eyes. So just from the side, I do not see, go around, inspect them both. I do see that his sclera is a china white. There is no cloudiness or scratches. His eyelashes are turned up and down, basically with the upper and the lower, which is normal. There is no abrasions, deformities, or masses found, no lumps, and no scarring. And his eyes are symmetrically located on his face, which is also symmetric with the top of his ears and the outsides and insides of his eyebrow where it ends and starts. For his test, I'm going to check that his pupils are equal and round, reactive to light. So for the patient, I'm going to have you put your hands. Perfect. You want to turn this way a little
Sure,
bit?
yeah.
That looks really low and dark. And you can look straight at me.
Okay.
And then that's the other one. Okay, so the pupils are equal, round, and reactive to light. They did have good reflexes based on the light shining, and when the light shone on one eye, the other one responded equally. Next, I'm going to do accommodation. So you can look directly at me. I'm going to have the pen here, and you're going to follow your eyes, and it's going to go to your nose. Okay?
Mm-hmm.
So the patient does have good accommodation skills and was able to track the pen. Next, I'm going to assess the second cranial nerve. So first, I'm going to have you cover one of your eyes. You can pick. Okay? We're going to do
other one. You can do the other one. That'd be useful.
Okay. And then I'm going to see if she can see it. Okay. I'm going to have my hand out and let me know. I'm on eye level with the patient. Let me know when you can see my hand come into view.
No. No. No.
Okay, and then we would do the other one to assess bilaterally.
No. No. No.
Okay, and now last eye test. I'm going to have you follow my light without moving your head.
Okay.
Just follow it. No head movement side to side, just with your eyes. And this is the 6 cardinal positions of gaze. Okay, and so cranial nerve 2 is intact. Next, I'm going to move on to the patient's temporomandibular jaw, just to check for any TMJ or crepitus. So I'm going to find the jawline under the mask. I'm going to have you open your mouth and close it. So no crepitus was found. I'm going to test your cranial nerve 11 and have you open your jaw with resistance against my hand, and then shrug up with resistance. So cranial nerve 11 is intact. Next, I'm going to move on to the patient's lymph nodes. I'm going to see if any lymph nodes are palpable or if there's any tenderness, which could be an indication of infection. So we're going to start with the pre-auricular, post-auricular, occipital, which is on the hairline, and then we're going to move on to submental, which is right here, submandibular, you can see that, and then we're going to go to jugulodigastric, and then you can look straight at the camera, cervical, turn towards your window, deep cervical chain, turn towards the wall, deep cervical chain, you can look again at the camera, and then posterior cervical and supraclavicular. And then I'll have the patient raise their shoulders for infraclavicular. Just a little add-on. Next, we're going to do your abdominal check, since we already did the heart and lungs. So I'm going to have the patient lie down. You can face whichever way you want.
Sure.
Yeah, that should be good.
It's like this.
You could just lie flat.
Okay.
And then I'm going to have you put your knees up. And typically, if the patient was wearing a gown, we would drape them. But as the patient is wearing shorts, we are not going to drape them, and we also don't have a drape. So, drape in theory. I would get on eye level with the patient's abdomen, and I would assess contour, I would assess size, symmetry. Location of the umbilicus is normal, it is not skewed at all, and there is no discharge noted. There is no hair seen, there is no pulsation seen, and respiratory rate is good and even and is seen in the abdomen. The first thing we're going to do is auscultate, so listen, starting at the ileocecal valve. My stethoscope diaphragm might be a little cold. Be prepared for that. So we're going to start in the lower right quadrant at the ileocecal valve, just listening for bowel sounds. We're going to go through all 4 quadrants. Bowel sounds are normal, not hyper or hypoactive. Now I'm going to move on. I'm going to percuss like this in all 4 quadrants, starting again at the lower right abdominal quadrant. Just let me know if there's any pain upon percussion. Okay, patient was not guarding and there was no pain vocalized and there was no dullness heard. It was tympanic. Next, we're going to move on to our light palpation. So again, starting in the lower right quadrant, let me know if you feel any pain on palpation. And next I will move on to deep palpation. Any pain? And then lastly, I will check for Murphy's sign by palpating the liver. I will do this by cupping under the liver while the patient is breathing in and sucking in their stomach, so I can check for any masses or deformities with the liver. I'll go on this side. So I'm just going to have you breathe in, perfect, and then I'll go in, palpate the liver, you can breathe out. So no deformities or masses felt on the liver, and again, there were no abnormal findings for the abdomen. So you can sit up. Put your shirt down. You can sit up now. Next, I'm going to do the integumentary assessment and just with the back of my hands palpate and make sure there's no abnormalities, deformities. The patient's skin tone is matching with the rest of his body all over, and it is good with his ethnicity. His skin is smooth, it's warm to the touch. No masses or deformities found. I'm just going to check for skin turgor by checking for tenting on the collarbone, and we're going to do that symmetrically. So the patient has good turgor, there is no tenting, so he is probably not dehydrated. I'm also going to check for capillary refill on the hands. And capillary refill on each finger is less than 2 seconds. I would do the same thing for his toes, just to check for capillary refill on his lower limbs. And then, let's see, I think that's good. I'm going to move on to the musculoskeletal, and we are going to be checking his range of motion. We're going to check for size, contour, shape, color. We're also going to check for any swelling or edema. We're going to check for temperature, range of motion, if I didn't already say that, any joint capsule or bony articulations, as well as for masses or deformities. So first I'm going to start with his hands and his wrists. So I've already checked for capillary refill. I'm going to check his joints on his fingers bilaterally, just to make sure everything is intact and symmetrical. Okay, so the joints are intact. I'm going to have you just splay out your hands, put them in a fist, and go back again. And then I'm going to check for, I'm going to check your wrist symmetrically. Bony articulation is noted on the outer sides of both wrists. I'm going to have you point your fingers towards the sky, point them down towards your feet. Do the same thing with resistance. Okay, the patient is able to have good range of motion, active and passively, and the test was done with resistance, and there was strong range of motion. Next, we're going to move on to the elbows. So if you want to put your arms like this. No dryness noted in the elbows, no masses or deformities, and then all the checks done previously. I'm going to have you put your elbows back, and I'm going to have you extend, and then flex again, and then we're going to do that together. Again, good active and passive range of motion with resistance. Next, we're going to move on to the patient's shoulders. We've already checked for cranial nerve 11, which is the shrugging and then jaw resistance. So I'm just going to quickly check the patient's shoulders for symmetry and for muscle tone, which seems to be even. I'm going to have the patient lift their hands up above their head and then down again. Okay, and now I'm going to just do resistance on your shoulders, up and down. Okay, good resistance felt there. Next, I'm going to have the patient stand so we can move on to their hips. I'm going to move the camera back a little bit. Okay. Now I'm going to check for hips. I'm going to palpate the patient's hips for any deformities or masses. We're going to check his range of motion and have him, first your left leg, you can abduct and adduct. Okay, now we're going to do that with resistance. Okay, the patient's left leg and hip have good range of motion with and without resistance. You can do it one more time. Okay, and then the same thing equally on the patient's right leg and hip have good range of motion passively and actively with resistance and without. That's good for hips. You can sit down. Here I'm going to inspect the patient's knees. If I had a reflex hammer, I would check his reflexes by hitting the knee right below the patella in the soft pad of the knee on both sides, if I had a reflex hammer. And then I will inspect the patient's knees for any bony prominences, joint capsule, and they're equal, and no deformities or masses found. Next, I'm going to move on to the patient's ankles and feet. Oh, it's kind of dark. That's okay. I'm just going to check the patient's ankles. Oh, I'm going to have you also range of motion for the knees after we do reflex hammer. Move this leg, and then on your own, and then this leg. We would do it equally. And now we're going to check out the ankles and the feet. So I'm just going to inspect the ankles and feet. I'm going to check pedal pulse. Here. No pulse deficit noted. And then I'm going to have you flex, toes up to the sky, toes to the ground. One more time. And to the ground. And then I would check, again, capillary refill on his toes. And then I would check each joint on his toes for any deformities, masses, or irregularities. After touching his feet, I would wash my hands. And then we're going to go to his cervical spine. For cervical spine, I'm going to inspect C7, which is a bony prominence. Why don't you put your chin to your chest? So C7 is located right here, as you get right there. It is a bony prominence noted, head to the sky. Okay, good range of motion. You can be neutral again. And then I'd also inspect his full, complete spine. So I'm going to have him stand up. Yeah, that'll work. I'm just going to check that it is straight. And I'm going to have you lean over, touch your toes if you can, and jump all over. And then just make sure there's no lordosis, kyphosis, or scoliosis. And the spine does seem to be in line. Lastly, you can stand up. Lastly, we are going to check his Romberg test as well as a gait test. So I'm going to turn the camera around over here and have Caleb, the patient, come over here. First, for the Romberg test, I'm going to have you stand with your eyes closed, feet together. I do not notice you can open your eyes. No swaying or balance problems. And then also I'm going to have you test your gait. So if you could walk, let's see, from over there to the TV and turn around and come back. Okay, the patient has good gait, no issues with balance. They were not stumbling or falling over at all, and they do not need any assistive devices. So the patient is pretty ambulatory, but I would have them go back in bed. I would lower their bed, put up the bed rails, give them their call light, make sure they don't need anything.